Hello, good afternoon, ladies and gentlemen. I am Dr. Singal talking to you today afternoon. I hope you are all doing well. The topic of my seminar today is piles, which are called hemorrhoids in our surgical term. And the main symptoms of piles, which all of you are very well aware of, is you get a bleeding from the rectum while passing stools, or it can be independent of the stools. Right in the beginning, I just want to emphasize one thing, that piles to begin with are painless. They become painful only if there are further complications of piles. So, what is a pile? Pile is a dilated blood vessel in the rectum which gets injured, or you can say traumatized, while passing a hard stool, and then it bleeds. So the attention is drawn by the patient because of the blood, and that is how they ask for a consultation with the doctor, because of the bleeding. But please remember that piles is not the only cause of bleeding from the rectum. There are many other causes, which is not the subject of discussion today. But piles is one of the causes of bleeding from the rectum. It is a very common ailment uh, because of our active lifestyle, and because we have a posture which is erect, and surprisingly animals don't get piles. It is only humans who get piles because of our posture. So the complications, or you can say the further problems which piles can cause, first of all, they may not cause any major problem. Patient keeps bleeding. At times they swell up, and times they decrease in size, and patient normally does not take medical advice. Mostly the advice is taken when the bleeding is perhaps too much, or when it becomes painful. So painful means that hemorrhoids have come out of the passage and they are lying outside, and they have become infected or thrombosed, or they are strangulated, and then it becomes a little painful condition which needs an active treatment and emergency treatment. Now, I will also try to tell you that certain things which are thought as piles, but actually they are not piles. So, what is the differential diagnosis along with the patient when he complains of bleeding from the rectum? So, bleeding can be, as I said, first it could be hemorrhoids, that is pile. Second, it could be fissure or a crack in the rectum. Third, it could be uh, some tumor lying somewhere in the anorectum, or it can be people who are taking anticoagulants. Anticoagulants like ecosprin, like heparin, because of any reason, they take blood thinners. And people who are on long-term blood thinners, they also can have bleeding from the rectum, which may not be piles at all. So once you have gone to the doctor for your consult, then all these things have to be kept in mind before the diagnosis is made. And if the diagnosis is made, then an examination with a finger, that is called perrectal examination, and proctoscopy is a must to confirm the diagnosis which you have made on a clinical ground. Once the diagnosis is confirmed, then the treatment modalities are available, which starts from, say, for example, from simple thing like treating the constipation. At times it helps, or we can do a bending procedure for maybe single hemorrhoid or two hemorrhoids, which are very large and they are like grapes. So we can put a rubber band with an instrument which we have, and we can put the band on the neck of the pile, and then becomes dead and comes out with the fecal matter in due course of time. So we can do one pile or two piles at a time. And it is an OPD procedure. For this, you don't need admission. And it is a very simple and very effective procedure. But it is selective in certain cases only. Then there is a standard treatment, which, say, for example, people like me have been doing it for 40, 45 years now. And there are modern treatments which have come up for the last 10, 15 years. You are aware of it. People call it staple surgery, they call it a laser surgery or other things. So being in the field of surgical practice means I have known what are the advantages and disadvantages of various treatment modalities. Or I can pick and choose what is required from my armamentarium, what methodology I should use for treating the piles. So the question was that what is the best way to cure piles? There is no standard treatment that one treatment is available for all kinds of piles. As I said, that based on the diagnosis and the presentation of the patient, the treatment modalities are chosen. As I said, it can be a standard surgery, or it can be banding, or it can be laser, and maybe staple. But all these things have to be seen that which one will be effective for what particular patient. There is no single treatment for all across the board. You have to decide which treatment modality can be chosen for one particular patient. Now, coming to the 100% guarantee means nobody in the world can give a 100% guarantee. But once the surgical procedure is done, normally the piles, they do not come back. But one can have secondary hemorrhoids, that in between the three hemorrhoids, which are normally present at 3 o'clock, 7 o'clock, and 11 o'clock, in between you can have small little hemorrhoids which can come up, but they can be treated with a simple method like anal dilatation and things like that. But the treatment for major problems of piles, when they become unbearable or they become very uncomfortable, the surgery is the only treatment. And there is no other treatment. People can go to a quack or can go to a homeopath, can go to anybody, but ultimately they'll end up with surgical management only. I'm not against homeopathy because I don't know much about homeopathy. It is also a science in its own way. So, but ultimately surgery is the answer. Now, there is one question, changing the food habits does help. You should take a lot of roughage. And somebody has asked for treatment for fissure. Fissure also has to be treated. They are like, as I said, one of the differential diagnoses of piles is fissure. So fissure is a crack in the anal canal and rectum. So this also bleeds. This also causes pain. So treatment of fissure also should be done. It is a fissurectomy or anoplasty. So which is nowadays is very, very successful, and we don't keep a wound open. We always put a stitch, and that is a cure. Now, you are asking for alternative like homeopathy or Vedic. I have already touched it. But since since I am not versed with homeopathy or Ayurvedic, I can only talk of my experience of surgery, which I've been doing for, as I said, for 45 years. That ultimately, patient does land up with surgeon only, even after trying homeopathy or Ayurvedic, which is not a cumbersome treatment modality. It is very simple. You take medicine and tell patient, okay, stay at home. So for years and years, people take medicines, but nothing happens. At the end, they all end up either with complications of piles, or they'll end up in between to a surgeon. So this is what I would say about Ayurvedic and homeopathy. Then there is one gentleman or asked, my father has piles, what should I do? So take him to a surgeon like me and let him examine and find out if it is really piles or he has something else. And once he has got diagnosed 100% that there is piles, now particularly in an age group above 50 or 60, I would advise that all patients of so-called piles should undergo proctoscopy and a lower colonoscopy to rule out any tumor or any malignancy in the rectum or colon. So there can be some cases who present with blood, but actually the cause of blood is something else. There is no cure of piles without surgery. I'm sorry. By early degree piles, early piles, you can treat with changing bowel habits or just dilating the anal passage under anesthesia. So it can be helpful in early stages. As there is another question, he's suffering from piles for 2 years. Instead, I have taken medicines. But if you have diagnosed piles, then of course you have to show to a surgeon, and then he can answer all your questions. Now, the major complications of piles, if they're not treated, they can become infected, they can become painful, and it is inconvenience. Your day-to-day life gets affected. You don't feel comfortable, and these are the complications. And once it bleeds, say for example, you are somewhere at a location where the medical facilities are not available, so it can be a problem unnecessarily. Yes, then there is some question. How can I prevent piles and colorectal cancer? Now, as I said, prevention is very difficult to say that by doing a particular thing you will not have piles or colorectal cancer. The best way is to have good eating habits. Good eating habits is take natural food, take good amount of roughage, and drink lots of water. Roughage means vegetables. Nowadays, people go for health foods, dietitian prescribed foods, and off-the-shelf foods available. These are all no, no, no. God has given us natural things. We should eat natural things. And then you can avoid constipation. Once you can avoid constipation, then a lot of other diseases are avoidable. Somebody has asked a question about the wife. Please show your wife to a doctor, a gynecologist first, and then to a surgeon. So he will diagnose what the problem is and then sort it out. Now, what is the best treatment for treating bleeding fissures is surgery. You do fissurectomy, put a stitch, chapter closed. Healing will be there, dissolving sutures will fall off, and that is the cure for this problem. Now, somebody has asked me that is there possible to do pile surgery without operation, without any stitch and cut and anything? How can you expect a surgery to be done without cut and without stitches? Surgery is cutting and stitching. Very simple, layman's terms. Cutting we can do with laser, cutting we can do with knife, cutting we can do with ultrasound. Cutting can be done by any tool available to us. We may or may not stitch, or there may not be a need for stitching in all cases. So surgery definition is cut and stitch. Warts. Yes, the warts also need antiviral treatment. There are creams available, but that depends on which kind of warts they are. If they are viral warts, then there is a medical treatment available. Antiviral treatments are available, creams are available, you can apply. But first of all, you have to see a doctor to find out which kind of warts they are. Yes, surgery cures the disease permanently, as I said before. But in very few cases, maybe 1 in 100 or 1 in 200, you can have secondary hemorrhoids, which can be treated with medicines and with the dietary treatment or with dilatation. Otherwise, surgery for piles once is done, because we remove the piles from the root. We close the root of the pile. So once it is closed from the root, then it cannot come back. Now, somebody is asking me best treatment for piles and anal fistula. As I am a surgeon, don't misunderstand me. The treatment for piles, if there are creating problems, then surgical treatment is the only cure, as well as for fistula. Now, the surgeon has to choose which treatment modality is suitable for which patient. From his bag, he should take out the best possible curative plan for a particular patient. Now, the general topic of piles and hemorrhoids, I think I have covered. If there are any more questions, I can answer them. But you should not be scared of surgery. Nowadays, surgery of any kind is very safe. We have got very good methods of anesthesia and short anesthesia or medium long anesthesias. We have got very good centers where all kinds of patients can be taken care of. And we have got tools in our kit. And with experience, you can find out which tool to be used for which patient and for which surgery. So don't be scared. A lot of people will tell you a lot of hearsay, lot of fears are there in people's mind. But then all these are baseless. All these are baseless. Today, everybody is a doctor. Everybody can advise you something or the other. So, but an expert opinion, it should always be taken. Nowadays, there are all portals available to get yourself educated. So that's not a problem. Nowadays, Google Baba has made everybody partial doctors, so everybody knows everything. Thank you. If there's any more questions, I can take care of. Otherwise, I've done with the topic of